Ipsos polling exclusively for Global News finds 80% of Canadians say their overall health has been good this year. 78% rate their personal happiness as good. 66% say their financial situation is good. And 6 in 10, 58%, would rate their romantic or sex lives as good. But the year hasn't been without struggles. Just 60% would rate their social life as good. That's down 13 points from last year. 30% say they've gained weight. 28% have struggled with their mental health. 15% have consumed more alcohol. And 7% say they're struggling with addiction.
You do start to see some cracks in terms of how people feel about the things that should contribute to their happiness. So I would say rather than treating it as an overall assessment and people just saying, I'm happy, I would take that as fine. You know, when people say fine, does that really mean that they're fine? Well, underneath, it's probably more going on. I would say maybe last year when we asked this question, we saw fewer cracks than we're seeing this year. If you look at the effect of COVID in Quebec, I mean, that's one hypothesis. It's certainly been much harder there than it has been in other provinces, although it's been pretty hard in other places too. But if you look at the length of time that they've been dealing with COVID and the extent of what the problem has been in the province, you could look at that as one of the things that's driving how people are feeling right now. There's this myth that exists in Canada that older people are somehow impoverished or are in desperate situations. There are older people who are, but by and large, the term that best describes them is the welderly. They're actually reasonably well off. They've got for the most part, good homes. They've found a way to save for their retirement. Their kids have all, moved out and moved on to other stages of life. And in fact, one of the things that's most interesting in terms of how the Canadian economy has changed is the amount of wealth that resides with our elderly population, and actually how they're doing just fine. If you want to find the trouble spots, you want to find the cracks, go to Canadians under the age of 35, because that's where you really start to see the cracks. It's interesting about these surveys. They actually do reflect what's going on in people's lives. And it would be a very odd finding if people were saying, I thought my social life was much better as a result of what we've been going through. Of course, we're struggling with the idea of being able to associate with other human beings, not just in our home lives, but also, at work. That's one of the other things that we find. People are missing their colleagues at work. Well, it seems we've either gone in one direction or the other. So about 10 points fewer than that say they've actually lost weight. So, it's one of those things where people have either, they've eaten their feelings, or they've gone in the other direction and they decided to do something about their health. But the preponderance right now is that people feel that they've put on weight, especially women. The younger people are less likely to say that they're doing well in this circumstance. And one of the things that seems to be affecting their lives is reliance on alcohol, addiction, and mental health issues, which are more highly correlated with youth in our population with older people. So older people seem to be riding this situation out a bit better than younger people, and where we're really starting to see the cracks show in terms of, for example, being able to maintain quarantines or being able to maintain even people's mental and social health really seems to be among our younger population.